Hello, welcome. This is Here's to Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical Center. And tonight I am so excited. Oh, you just don't know how excited I am. We have an infectious disease specialist right here in Rocky Mount. Can you believe it? The closest it used to be for years was over in Tarboro. And Dr. Castillo, she moved maybe a year ago. I'm not exactly sure. Her mama got sick and she went back to home. So Nash snagged Miss Paula here, and I'm just so excited. And you will be too when you listen to, she is our resident expert on COVID, as much of an expert as anybody can be, because it changes every day.
It does.
And the data changes every day, but she's going to talk to us about that. She's brought a little slide project. She is on it. She is ready to roll. So thank you for coming, and welcome to Nash County, to Rocky Mount. How long have you been here now?
I've been here since September.
Oh, okay.
Almost a year.
Yeah, good. Okay. So tell me about yourself, a little bit about yourself. Where were you born? What did you do?
Going back that far. I was born in New Jersey. I've been pretty much all around the country. I went to school, to college in University of Utah in Salt Lake City, where I received my pharmacy degree. So
I remember seeing that. Yeah. Okay. So you're a pharmacist.
I was a pharmacist.
You were a pharmacist.
I haven't practiced, and I practiced for about 15 years, but then it's been about maybe 15 or 20 years since I actually practiced pharmacy. But I did get my pharmacy degree from University of Utah in Salt Lake, and then I went on to get my Doctor of Pharmacy from Idaho State University. Then my family and I had moved to Texas. We were raising a family. I was a stay-at-home mom for a while, and I did practice as a pharmacist part-time. And then when my kids went back to school full-time, I'm like, I've always wanted to go to medical school, but due to my family obligations, I didn't. And I decided to go back in 2003.
Good for you.
So we moved to Florida, in Fort Lauderdale, and I went to Nova Southeastern College of Osteopathic Medicine, where I graduated. And I was very fortunate to do residency in internal medicine in Miami at University of Miami at Jackson Hospital, where I also stayed on for my fellowship in infectious disease at the University of Miami.
Awesome. Is there more than one DO program in Florida?
Yeah, there are quite a few DO programs, and they're actually opening up quite a few around the country.
Yeah, we have a DO who practiced. She got her DO in Florida. That's why I asked, because I have no idea where she got hers. And she was in the Navy. She just retired from the Navy not too long ago, a few years ago. So, all right. So you kind of always wanted to be a doctor, you think?
I want to say since I was 5 years old, and I fell off a horse and cracked my head, and saw I was 5 years old and went to the emergency room with my father, and I saw the lady doctor in the emergency room who stitched up my head, and I'm like, Dad, I want to be a doctor. So
it's interesting, isn't it, how those episodes in our life kind of shape us and form us. And I watched Emergency 100 years ago on TV, and I always wanted to be in the emergency room. And when I grew up, I worked in the emergency room for about 13 years at Nash. Yeah, so
it's a hard job.
Yeah, it is, but it really prepared me to be a nurse practitioner. I learned a lot in those years. So that's awesome. All right, so do you think your pharmacy background helps you in being a doctor?
Yeah, of course, just having the knowledge of the medications that I'm using right now as an infectious disease doctor. I did, when I was in Miami, I graduated from a fellowship there, and I did work in a private practice for almost 7 or 8 years. And then I actually was able to mentor medical students from Florida International University. But I'll tell you, the hardest thing, when I was rounding with them, they always told me it's so hard to memorize all those antibiotics. And when I started as a pharmacist, there were a lot less antibiotics than there are now, but at least I had something to build on. So I think in that respect, it was much easier for me.
You think antibiotics are bad? Try diabetes.
Oh my gosh, yeah.
I don't know, 10 classes, and each class has 10 medicines in it. It's something. But anyway, so ever use any of your pharmaceutical your pharmacy training in just your, general study and all? I imagine you do.
Yeah, so I actually, of course I know the value of a pharmacy team, and no matter where I've practiced as a physician, also when I was a pharmacist, I was a clinical pharmacist, I rely on my pharmacy colleagues to help dose the medications, to make recommendations from IV to oral transition, and actually to help me figure out what's the best antibiotic for this patient that I have. So they're invaluable.
Yeah. Are there any new antibiotics or anything coming out it's been,
well,
we've had all that resistance for so long, but I don't really hear much about new antibiotics coming up the pike.
And that's true. They have re-engineered some of the older antibiotics, repurposed some of the old antibiotics, but honestly, there's a paucity of new agents coming on the market right now.
Yeah,
so.
okay. Well, we'll just keep on keeping on. So, what's the most interesting part of infectious disease to you?
Oh boy, there's so many interesting things in infectious disease.
Go ahead and expound.
Well, infectious disease, the reason why I really enjoy it is because it's so multidisciplinary. I'm not beholden to just the kidney or the heart. So I work with many different professionals, many different groups, many different physicians. So you're always challenged. And the thing is, we treat, say, a urinary tract infection. It's never the same.
Right.
It's never the same. Every patient's different. Every patient has a challenge. They all might have, say, a urinary tract infection with a bacteria called E. coli, but then you have to look at the patient. Well, the patient has allergies, or they don't have good kidneys, or there's other. So they're all unique, and every case is unique. Even though you think you've seen it all.
You've never seen it all, have you?
No.
I just wanted to break for a minute. We are live tonight, y'all, so if you all have any questions, especially about COVID, we're going to get into that a little bit, and she's got some slides and some detailed information that we're going to go into probably in the second segment. But if you have any questions, give us a call, 252-407-1111. I almost said my husband's phone number. 407-1111. Okay, I just wanted to throw that in there because sometimes these are repeats, so I like to tell them when we're live. Of course, then they repeat it and then it's not live. But anyway, okay. So give me some examples of infectious disease.
Examples of infectious diseases, there's so many. We did mention urinary tract infections. We have the acute infections like UTIs, respiratory infections like pneumonia. I'm just kind of going down the body.
Go down.
Meningitis, that's an infection of the fluid that's surrounding the base of the brain. Eye infections, upper respiratory infections, ear infections, lung infections, abdominal infections such as diverticulitis. We have lots of skin infections. I see a lot of wound care and wound infections, especially with our diabetic population. Also our paraplegic population, we deal with a lot of wound type issues. And even dental infections, we've dealt with that too.
Really?
Yeah.
Have you seen some emerging new types of bacteria that are, or evolved bacteria?
Evolved is a good term. We have the garden variety of bacteria. However, since there's been a push over the years, even as I was a pharmacist, for what we call antibiotic stewardship, because of the overuse of antibiotics in the past. Anytime our body's exposed to an antibiotic, we have bacteria that live in our body that actually infect ourselves if they get in the wrong place. That have mutated so bad where it's very challenging to treat some of these infections because I've run out of antibiotics because there's so much resistance in that bacteria. There are some new fungal or fungi Candida species that actually are very resistant to the current therapy that we have that have evolved probably over the last 5 years or so. We've seen those. So.
Yeah, it makes me sad. It makes me crazy, actually. I had a question. It was a great question, too, and I can't remember what it was. So is there a lot of C. diff still and VRE and those kind of things? Or
Well,
The hospital was full of it all at one point.
right, and then actually that is, one of our metrics in the hospital to decrease the hospital-acquired C. diff, or the new name is Clostridioides difficile, which we're doing a great job. We hardly see any cases that are in the hospital, but of course, C. diff is the acronym for the Clostridium difficile. You're always at risk anytime you take an antibiotic to develop C. diff. And C.
Yes.
diff is basically I tell my patients, it occurs when you're exposed to antibiotics, and it can be antibiotics that you were exposed to either yesterday or like 6 months ago that will kill the good bacteria and let the bad bacteria proliferate. And it's, we can run into a lot of problems. It's manifested by very severe diarrhea. But then the severe cases, especially in our elderly who get dehydrated with the diarrhea, can come into the hospital with kidney failure, as well as our colons can expand so much from this disease that they have to go for emergency surgery.
Oh, geez.
Yeah, to cut out the disease. So it's a very serious disease.
If you could, for all the young moms out there listening, because, baby cries, pulling on his ear, have to have an antibiotic. And I was that way when my kids were babies. You might have been too, I don't know. But it really is important. And I guess maybe that's not the best example for me because I work with adults. But, I'll have somebody that wakes up with a fever and they come to the office and they want an antibiotic. And they get mad if you don't give it to them.
Yeah. Yeah, so that is a challenge, and it is very scary when you wake up and you're sick and you feel awful and you have fevers, and automatically, we think we have infections, which fever and not feeling well, of course, equals infection. But there are infections that we won't be using antibiotics for, such as some viral infections. There are infections that we can use antivirals for, like the influenza or the flu. But a lot of the upper respiratory infections that you can have fevers, even chills, maybe headaches, sore throat, are viral infections that we don't treat. And we have to, I would recommend contacting your healthcare provider since they're the experts in assessing this, but trust them if they say, well, maybe we'll just hold off on antibiotics right now, because they'll know the warning signs of a bacterial infection that needs to be treated with antibiotics versus a viral infection that maybe your body can fight it off.
And you have to know that a virus can last up to 10 days. So, if you called the doctor at day 2 because you didn't feel well, day 7 you're still not feeling well. Sometimes we just got to wait it out. But anyway, we'll get in. That's another one of my. I got lots of soapboxes. I got too many soapboxes. Okay, so what are some of the common misconceptions about infectious disease?
So I've run into so the internet is great. And I really encourage my patients to go on the internet to research, and also social media, to research diseases and come to me with questions. But there might be misinformation or misconceptions on social media, or such as vaccinations. Of course, I'm an infectious disease doctor, so I support vaccinations, and I understand there are some concerns about different types of vaccinations, which we all need to be aware of, and we all need to be able to know to report any adverse effect. But there might be some misinformation about vaccinations, and that's a challenge in the infectious disease community.
Yeah. If you had to sum up everything for our public or our audience who probably and maybe has never even heard of infectious disease, kind of give us a broad, this is what infectious disease does.
Well, infectious disease specialist, what we do as a whole. Okay.
Why do I want to go see you? When should I come and see you?
So, I'm also trained in internal medicine. So, and as an internal medicine doctor, we were trained for the basic, for basic infections that are pretty straightforward. But sometimes these cases can be challenging. We'll need an expert opinion in infectious disease. So, after my internal medicine residency, I did special training just in infectious diseases, and that's all I deal with right now. Is I just treat infectious diseases. So, like we were talking about earlier, it can range from head to toe. It can range from bacteria to fungus to viral infections. But that's what I specialize in. That's what I've been trained in, and that's the only thing I treat.
Yeah. Well, I'm just so excited that you're here. I want to.
I'm excited to be here.
But talk about a couple of things before we get into COVID, because that I know that's what is on everybody's mind. But what about like Lyme's disease? That can really be pretty bad.
Yeah. So I have to tell you, I've been practicing in Miami, which we don't see Lyme disease in Miami. Well, the only time I see Lyme's disease is when we have patients coming from up north who actually bring the Lyme disease down into Florida. So my experience was very limited to Lyme disease. And moving up here, I'm like, I better.
You're gonna see a lot of it.
Now, not so much Lyme's disease, I have to say, but others spotted, like tick-borne fevers or spotted fevers, such as Rocky Mountain spotted fever. I have actually seen a couple cases in the last few months I've been here, and also other tick-borne illnesses, like there's a parasite, or a rickettsial disease called Ehrlichia. This is also transmitted by the tick. So we definitely have to be aware of those infections. Now, Lyme disease, it is in North Carolina, it is in this area, but not as prevalent as it would be further up north. And I've not had a case of Lyme disease since I've been here yet, but I do have.
You will. I've had them.
And I
know
do
you
have
will.
help. I've actually have talked to my Chapel Hill colleagues to help me out on the tick-borne illnesses too.
So if I have somebody that's positive Lyme and I treat them with doxycycline, would I still send them to you, or see how they do to determine that?
You know,
I'm putting you on the spot.
I know you are, and I would think. I mean, if you feel comfortable treating that, since you know, as a general practitioner, yeah, I don't know if I would be necessary. I would help out if there's complications.
Okay.
Okay. But yeah.
All right, that's good. Well, we're going to take our first break. We're at a good stopping point, and we'll be right back. So think about your questions. We'll be talking about COVID, the second section, and she's got some slides where she's going to talk about, and so it's going to be good. So don't go away. Watch the commercials. Step in place, get a little movement going, get to some water, and we'll be right back.
At Down East Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Down East Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Down East Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
Hi, I'm Richard Goss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
Hello, hello, welcome back. This is Here's to Your Good Health, and I'm with Dr. Paula. I'm not even going to, I think I can say it, Dilanchian.
Close. Can I help you out a little bit?
Yes.
How about Dilanchian?
Dilanchian.
There we go.
You know, a name like Prezioso, I'm conscious of trying to pronounce people's names right. Dilanchian. Okay. Anyway, we are going to be talking about COVID, so I just wanted to let you know, be watching. We're going to bring up these slides that she stayed up half the night preparing for us. So I was sound asleep when she was still typing away. And then we're going to, she'll be expounding on them, and if you have any questions, give us a call. So, okay, Lee, we'll go ahead and start. Okay, go ahead, Dr. Paula. Dilanchian.
Perfect. So this slide actually is not a COVID slide, but you know, I was going over some of the points that we might want to touch today in the interview, and it was talking about the percentage of physicians in rural versus suburban settings. So I just wanted to put this slide up, and you can see that the bottom line actually represents in chart A, this is from the JAMA article a few years ago, shows that there's a very low percentage of primary care doctors in the rural setting. And then when you look at the next graph, you'll see the medical specialties are very low also. It's like, gosh, less than 10%.
Mm-hmm. Hang on, Lee. Go back. Thank you. Okay, go ahead.
So I just wanted to point that out, that we do have a paucity of general practitioners as well as specialists in the rural community.
You ready for the next one?
I'm ready for the next one.
Next, please, Lee. Okay, go ahead.
So if you like, I can go ahead and start talking about vaccines. So
talk away.
So these, I just have to mention these slides. I did not stay up drawing these slides and these cartoons last night. I got them right off the CDC website. They're available to anyone. It's just cdc.gov, and just click on the COVID tabs. But these are two cartoons looking at the viruses that are available now, and everyone's probably pretty aware. We've got the Moderna and the Pfizer vaccine, as well as the Johnson & Johnson or Janssen vaccine. So basically what these two vaccines do is that they're injected into the body, and it helps the body produce antibodies toward a protein that is on the COVID virus, and that's called the spike protein, and you might have heard about that in the news. So there's a couple of methods that we're able to do this. The one is the mRNA vaccines, and those are the Pfizer and the Moderna vaccines. Basically, we inject the mRNA that codes the spike protein of the COVID virus into our body, and then our body has the equipment in our cells to manufacture the spike protein. And when our body sees the spike protein, then it sees it as foreign, it produces antibodies, and we make memory antibodies. So after we have the vaccine and we're exposed to the virus, then we have the ability to fight off the virus. Similarly, if you look at the other viral vectors, such as the Janssen or Johnson & Johnson vaccine, they actually use a virus called adenovirus as a vector to promote those the molecular material into the cell so our cells can produce the spike protein. This adenovirus is not pathogenic. It doesn't cause disease in humans. It's just called a vector, so it helps get the molecular information into our body to produce the proteins.
Now, are these like forever, or are we going to have to do boosters like flu, or
That's
do
a-
we know? We don't know that yet.
That's a really good question, and that's something, as far as the durability of these vaccinations, that's the question right now. And there's a
Okay.
lot of people working out there in the community and the academic centers who are trying to answer that question for us.
Okay, well, hold that thought, and we'll do that another time. Okay, Lee, to the next one, please.
And I just, I got this slide also off of the CDC. This also talks about the Johnson & Johnson vaccine, and as you know, there have been a real side effect of clotting that we've seen with this vaccine. It was taken off the market for a few days and put back on. It's a very rare side effect. It's seen in 7 per million vaccinated individuals, and mostly young women from 18 to 49 years old. But we should be aware of this, and the public should be educated, so when they decide what vaccine they want, at least they know, what the side effects are, at least of this vaccine. And there's warning signs. They say within a few days, if you have any headaches that are not usual for you, any signs of clots like in your legs, chest pain, of course, and you need to go right to the emergency room. Mm-hmm. And I didn't mention earlier, so the Moderna and the Pfizer vaccine, they're two shots given, separated by a certain period of time. Mm-hmm. The Johnson & Johnson vaccine is one shot, and there's some advantages to that, especially for people who don't have the ability to come. They might be transient in the community who don't have the ability to come back, mm-hmm. or don't have the transportation or the means to get the second shot. So the Johnson & Johnson shot would actually, or vaccination would be, a benefit in those certain populations.
Right.
But each individual has a choice of these 3 vaccinations
And
right now.
Didn't they find out that the majority of the blood clots from Johnson & Johnson were young women?
Exactly.
Did
Yes.
they ever find another common denominator of something?
Not that I'm aware of, but usually, like the young women, and it's very rare. Like they found, the
Yeah,
rate is
yeah,
7
yeah.
in a million. Yeah.
Yeah, I know, it was very
Mm-hmm.
rare. All right, Lee, the next one, please.
So this is these are 2 slides that actually I got off the MMWR, which is part of the CDC, and it's just showing that after 2 shots, so we're referring to the Moderna and Pfizer, that we have 94% efficacy of preventing symptomatic COVID-19 infection, and then we also are finding that we reduce the risk for hospitalizations among high-risk patients, such as or high-risk people, such as people over 65. So we're preventing the infection, and even if there's a small chance that you do get the infection, you're less at risk for being hospitalized in the higher risk groups or the higher age groups.
All right. All right, sir, next.
So I like these slides also because it compares what activities are safe for fully vaccinated people compared to unvaccinated people. And as you can see, on the fully vaccinated people, the CDC is recommending that we don't need to wear masks if we're outdoors. If we go into smaller areas with other people who are vaccinated, we can travel more freely. It's going to be a little bit easier traveling internationally if we're vaccinated compared to people who aren't vaccinated. And if you can see, the majority of activities, they're recommending masking for unvaccinated people. And then the next slide pretty reiterates what we just said as far as what we can do as when we're fully vaccinated versus unvaccinated.
Right. Do you happen to know about Nash County, about where we are number-wise? 50% vaccinated, or?
We just actually, I think we're about 27% vaccinated, and that just came from data that actually I went to a meeting for. So,
Okay.
yeah, don't quote me on that, but I'm thinking.
That's kind of low.
Yeah, Renelle's checking those numbers for me. Yeah.
Oh,
So we'll get you
good.
the exact
We
number.
got
I don't
somebody
wanna
back
talk
here
off the top
flying
of it.
fingers over
Yeah,
the
so we can get you
computer.
the
All right,
up-to-date
I was just being
information.
curious.
Yeah.
Okay, Lee, next one, please.
And then this is just information about the COVID-19 vaccinations that we offer at Nash UNC Healthcare. And these are numbers that we can provide and what we provide when the clinic is open for vaccination to the public.
Awesome. And so people can go to the hospital and get the COVID vaccine?
Yeah, I believe it's the day surgery. The day hospital, yeah, that the clinic is that they
Okay,
can get
and
vaccinated.
they have to make appointments, I guess, probably? No appointment, walk right in and say, here's my arm. Okay, well, that's great. I didn't know that. I mean, you know, I only know of what people tell me because I don't have it. I don't watch TV and I don't read the newspaper. I'm pretty uninformed. Okay, next. Oh, hang on, Lee. Here's a phone call. We're going to answer this. Hey there, this is Linda. How are you?
Good evening.
Good
I'm
evening.
enjoying the program.
Thank you.
I have a question.
Sure.
Since the vaccines have come out, you don't hear a lot about anymore the treatments, the Regeneron, and all of that. Are we still advancing the treatments? Because you just don't, like I said, you just don't hear a lot about it.
That's a great question. So the question is, what are we doing to treat the infection? So far we've just been talking about how to prevent the infection. So actually, my next slide does talk about the Regeneron. So perfect timing for that question.
Yes, awesome.
Okay, I
hopefully
will
I can
hang up
answer.
and watch.
All right, thank you. Thanks for calling. Awesome. Okay, Lee.
So here we go. So the next thing I wanted to talk about were the monoclonal antibodies. And at Nash UNC Hospital, we've actually opened up a clinic. Right now, how long have we been doing since October? Yes, since before the holidays. We're offering an infusion of what we call monoclonal antibodies, and this is what our caller just referred to as the Regeneron product. It contains two different monoclonal antibodies. Sorry, I got tongue-tied there. That in one product. So I just want to kind of step back and tell the audience and describe to the audience what a monoclonal antibody is. So basically, a monoclonal antibody, it's been used in the past extensively for our oncology and our hematology patients. But basically, this is produced in the laboratory, and it mimics the antibody that our body produces to fight the COVID infection. So if you might remember a few months ago, well, probably, gosh, almost close to a year ago, we were using convalescent plasma for our patients for treatment that were in the hospital. And the theory behind that is that patients who have the infection produce antibodies, and after they survive the infection, they recover, they have antibodies left in their blood, and they donate their blood. And then we were giving the blood from recovered patients to patients who were acutely ill with COVID, hoping that the antibodies that these patients who had COVID were being able to transfuse into the patients that are actively ill and very sick. The only problem with that is that you don't know how much antibody was produced. We don't know how much antibody we're giving the patients at that time. And also, it's a blood transfusion, which comes with a slew of problems itself. So what we were able to do is produce these type of antibodies in a laboratory setting in their pure form. And that's what a monoclonal antibody is. So we have products that actually have the pure form of the antibodies similar to what our body produces against COVID, and we can infuse them directly into patients who have been infected with COVID. So there were actually 3 products that first had come out for emergency use authorization. One that was a single antibody infusion, and then there's 2 other products such as the Regeneron that have 2 antibodies in each product. Right now, we're seeing some variants with COVID, and it's recommended that we use the combination product. So that's what we're offering at UNC throughout the system and through other hospital organizations too. So we do have an outpatient clinic that provides this infusion. We first were having patients come in through the emergency room referred to our clinic. But now we've expanded that to our primary care physicians, and now we actually have patients that can self-refer themselves.
Oh, great.
Yeah, there are certain criteria. First, you have to be infected with COVID, obviously, but we need to make sure that you have symptoms or you're diagnosed for less than 10 days, because the earlier you get this infusion, the more effective it is, obviously. When we first made these products available, we had a fairly narrow criteria, and we were just trying, well, it was based on what the investigation literature had told us that we needed to use for a criteria. And at first, It was patients who were at risk for hospitalizations for COVID, when they were infected with COVID, such as our elderly, our immunocompromised, our patients with comorbidities such as COPD, diabetes, heart disease. However, that criteria is ever expanding. We actually have expanded it recently. So it's going to be available to quite a bit of the population who are infected with COVID.
That's great.
Anything we need to add right now to that? You think?
Number is beside your name on the screen.
Okay.
Okay.
COVID helpline, self-referral.
Okay. The number you can call for this will be up on the screen next to Dr. Paula Dilanchian. I'm going to get it. I'm going to get it. Dr. Dilanchian. There's that COVID helpline. Are they still giving platelets to people too? When my husband was in, he was in the hospital in January. He got platelets.
No, we're not using that as
Not anymore.
not common therapy. no,
Okay.
no.
Okay. Maybe because he was hospitalized.
yeah.
I
I mean, we do give platelets to people, but that's not a therapy right now we're using for COVID.
don't know. Okay. Well, I think this is great. Okay, Lee, the next slide. I don't know. Maybe we're done. Nope. Here's more.
So this is our flyer for the monoclonal antibody infusion clinic, and you can see I just put on the right hand of the slide examples of adults with high risk for COVID-19 progressive hospitalization. So this is, and actually we've just expanded this list, so we actually are including more people. But people who have BMI or body mass index greater than 35, elderly people greater than 65, also people who are immunosuppressed, like cancer on chemotherapy, HIV, or are receiving immunosuppressive treatment, have heart disease, lung disease, diabetes, high blood pressure. So, and like I said, this list keeps on expanding.
Yeah. What about all those biologics you have for like rheumatoid arthritis and stuff? Are they at a higher risk
Yes.
too? Because that's
Yes.
immune compromised too, isn't it?
Exactly, yeah. So patients who have things like or diseases such as rheumatoid arthritis, lupus, even psoriasis, Crohn's disease, they use biological agents that decrease the immune system or the immune response, and they would definitely be eligible for this product.
Okay. All right, Lee, next.
So the other thing I wanted to mention too is that we've seen a lot of patients who recover from COVID, who the lungs are doing great from an infectious standpoint, but they're just weak. They have no energy, maybe some low-grade fevers, and UNC Health is offering this COVID recovery clinic, and I just put this slide up here to say that it is available. This is actually on the UNChealthcare.org site too. And
That's
this is
good
available.
to know because I've got some patients that now they've got chronic coughs, from having, they had COVID in October and they're still coughing, and pulmonology has deemed them chronic cough and they have to go on inhalers and stuff. So this is good to know, and of course I guess everything about COVID is just ever evolving. And so it's frustrating from a provider perspective because I feel like my hands are tied. You can't do much, Okay, Lee, next.
So these are the just some of the websites that I got my information from. Also, Nash County, NorthCarolina.gov has a up-to-date dashboard.
We have another call. All right.
Okay.
Hey there, this is Linda and Dr. Dilanchian. You have a question?
Yes, I have a question for you. What's the blood type that you have seen the most deaths of?
The most deaths?
Yeah.
Okay.
Was it A or O or what?
So the question is, what's the most prevalent blood type that we've seen with the deaths? And I have to claim ignorance to that because I'm not aware of a particular blood type that you're at higher risk for dying from COVID. But that's a good point, and that's something that definitely need to look into.
What made you ask that? Have you heard something or read something?
Well, I heard that people with A, it's more dangerous for them than it would be for somebody with O.
Oh.
Yeah, I'm not aware of that.
That's just what I heard. That's the reason I'm asking.
Well, you've stumped us.
Yeah.
That's pretty good to stump two pretty
So I'm
smart
going to go
ladies.
ahead and look that up.
All right, thanks for calling.
Thank
Bye-bye.
you. The other thing that I also wanted to mention, because the other caller was asking about other treatments for COVID, if we have a second to talk about that. So, and I don't have slides for these, but once you get, if you're unfortunately admitted to the hospital, there are therapies that are available. There is the antiviral remdesivir that actually is available. We use that. Usually best used in the beginning when you first have symptoms. Of course, steroids or dexamethasone, some of your listeners might have heard of that. That's kind of the cornerstone of therapy, any anti-inflammatory, for its anti-inflammatory properties. We also have stronger anti-inflammatories, such as biologicals, such as tocilizumab, which we can give patients who are even more ill, requiring more acute care.
Wow. Do you consult on all those COVIDs in the hospital, or they call you if they feel like they need you?
It's the treatment in the hospital is pretty well defined right now. So our hospitalists are great at managing it. We have a great pulmonology physician. So who also does ICU. So they call me when there's complications of other type of infections past COVID.
Yeah. My husband was there and he was treated great, so I appreciate it. All right, are there any more slides?
No, I think that's it.
Okay, we're going to take our next break, and when we come back, I love the questions, y'all. I'm pretty impressed that you stumped us, to tell you the truth. So we'll be right back. Think of your questions, and we'll have more of you. Here's to Your Good Health. Hang on.
At Down East Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Down East Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Down East Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
Hi, I'm Richard Goss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports, compression hose, to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
Hey, welcome back. Here's to your good health with Dr. Dilanchian and Linda. And so we've been talking about COVID. We've had some great questions. Thanks so much for calling. It really, it helps us, you know, and makes us think about things like, does your blood type make a difference? So we're going to find that out, and I'll let you know. Dr. Dilanchian can let me know, and the next time I have a show, I'll tell you. So got to keep watching now.
Great question.
All right, let's see. There's really no treatment for, well, there is treatment for COVID if you're super sick and in the hospital. But like for me, seeing somebody who's maybe, you know, body aches and snotty nose and a terrible headache, and then I get their results the next day, it's positive. There's really not much that I can do for them, or is there, and I'm missing it?
So the monoclonal antibody infusion is treatment.
Okay, so I can send them all?
And the patients can also self-refer, so
Okay.
to see if they meet criteria.
And is that paid for by insurance, or?
So right now,
Do you know? I don't
patients
know.
don't pay for the drug. However, there might be some administrative costs
Okay,
to
sure.
the infusion.
You know, us nurses, we've got to get paid.
Of course.
Okay, so if I've got positives, I can send them there over to you.
Yes, I would. They can be sent to our referral center and see if they meet criteria, and then they will be scheduled for an infusion.
Okay, so they can call and they'll be screened on the phone for the criteria?
Yes.
Okay,
Yes. And then we have that. Yeah, we've got the COVID helpline. They can just go ahead and call that COVID helpline, and we'll walk you right through it.
Awesome. Let's see. So where is the closest infectious disease other than you? Is that like Greenville and, does Raleigh have one? I don't know.
Oh, yeah, Raleigh has, they have a plethora of infectious disease doctors. So, yeah, they have quite a few. But I heard, let's see, Wilson. Well, that physician might go, mostly in Greenville, I heard. I just was talking to someone today, finding out where my colleagues are.
Okay.
But I think the closest one is about 30 miles away.
Well,
So-
Greenville's about 45
45
minutes.
miles, yeah.
And Raleigh's, they're kind of the same,
Uh-huh.
about the same amount of distance.
I'm
so.
learning my geography
Yeah.
around in
I
North
didn't
Carolina.
realize that
so-
Wilson had one.
Yeah. I think that physician, I don't know if he still has a practice there or not, but I know he definitely is at Greenville. So I think
Okay.
there was a practice.
Yeah, they move around a lot. It's hard to keep on track sometimes. So let's see. Have you, after you've given the monoclonal antibody therapy, did anybody follow up, see how they're doing? Because I know NASH is great about following up from surgery, from your knees, from, I mean, any intervention they have, there's a follow-up. So I was assuming, but so what are some of the questions they ask about that?
So yes, we do have follow-up. We have very close follow-up. We do have a dedicated nurse that calls every patient who receives the monoclonal antibody during the week, a couple times during the week, and then a few weeks after that, to make sure that they're not having any adverse reactions toward the infusion, or they're not having any worsening symptoms for with the COVID virus, making them go to the emergency room. Now, when they're in the clinic, the infusion itself takes about an hour, and then we also monitor our patients for an hour after the infusion. The most worrisome effect or side effect of these drugs is severe allergic reaction.
Sure.
So that's why we have to keep the patients in the clinic for an hour after the infusion.
Yeah. Of course, that's with any drug, really. So is there anything new on the horizon to avoid COVID other than masks and hand washing, or is that the standard still stands?
The standard still stands, and I can't emphasize more as far as hand washing. You know, if someone's sick, have them stay home, don't go to work, don't go to school. And then, you know, of course, the masking recommendations will be, as this evolves, the CDC will come out with recommendations periodically for masking.
You know, I think one good thing that came out of this is, from a primary care perspective, is, oh, we got another call. Hey, this is Linda and Dr. Dilanchian. How are you?
Oh, I'm fine, Linda. How are you?
I'm good, thanks. What's your question?
I have a question. My son had the COVID right when it first started, and he still hasn't got his smell and taste back.
Oh.
Is there anything that he can do or go see about that?
Well, we don't have therapy for that, but we did mention that there is a COVID rehabilitation clinic who might be able to help him out. And if we can, I don't know if we can get that number.
Quick?
Yeah, we'll maybe put those slides up, or if we can provide that number again. But if you go on the unchealthcare.org website, they'll have all that information for the COVID follow-up. Also, I would recommend close follow-up with the primary care physician, because they might have to refer your son to specialists that specialize in hearing. So to make sure that there's nothing else going on, and this is definitely not part of the after effects of COVID. So I would recommend close follow-up with your primary care physician.
Okay.
How old is your son? Is he grown, or does he have any medical problems?
Well, no. The only medical problem he had was he did have a heart attack way back a few years ago, but that's been solved, and he's on, seeing his regular doctor and all for checkups and all that stuff. But he just can't get that taste back, and smell.
Yeah.
I think some of his smell's coming back, but the taste, he tastes nothing. He just knows it's hungry. He's got to eat.
Yeah, that I didn't have that, but I know my daughter-in-law had it, and she was frustrated after a couple, 3 days. I just want to smell, You don't think about it, I guess. Let's see. Okay, you can call the COVID helpline, and it's 888-850-2684.
Okay.
And ask them for the rehabilitation for COVID. And you could get your son over there.
Then, well, I'll pass that information to him.
Great.
Okay,
Good luck.
Thanks for calling.
Thank you.
Well, I forgot you just said that, and it went right over my head. So let's just kind of go over the outpatient portions for COVID at the hospital, so that people can get that in their head, what we can do.
So for preventative measures, we have the vaccination program, which is at the Nash Day Hospital. And of course, that information you can get from the COVID helpline. And people who aren't in the area of Rocky Mount also, they have other facilities, of course, that are offering vaccinations. I also recommend you to visit your Department of Health website and be able to list the different facilities that provide vaccinations. As far as treatment outpatient, like we had mentioned, we have the monoclonal antibody infusion program that you can self-refer yourself. Call the number on the bottom of the screen, as well as talking to your primary care physician.
And then the COVID rehabilitation.
And the COVID rehabilitation.
that we just talked about. So, yeah, I think that's awesome. This is kind of news to me, so I'm very ashamed to say that, but
that's why you bring us here.
That's exactly right. That's why I have her here tonight with us. So I think we've about covered anything. If anybody's got a question, we got about 30 seconds left, so think quick and call real fast. Well, I didn't ask, now, if a patient feels real sick and thinks they need to see you, can they refer themselves to you, or you need to go through primary care?
No, patients can come to my clinic and request appointments. However, I don't take care of acute infections. If you feel like you're like you said, very sick, I recommend going to the emergency room or your primary care physician. And then if they need, I can help them out. But my clinic right now is open on Tuesdays and Thursday afternoons, and by appointment only. But yeah,
Okay.
patients can give our office a call.
All right. So now you guys know as much as I do about all the services out now. Isn't it great we have such a up-to-date place right here in our little town? I mean, we're just so blessed to have all the services that Nash gives us. I'm really grateful to it all. All right, it's time to go. Thanks so much for watching, and we will see you next week with more of Here's to Your Good Health. Good night.
Good night.